It's a beautiful day at Lowenstein Chiropractic Center. I'm Dr. Tessa Lowenstein, and today we'll be chatting about TMJ. More importantly, asking the question, can chiropractors help? First question, of course, with that is, what is TMJ? TMJ is the temporomandibular joint. Now that's the name of the body part. What's the condition? The condition is inflammation. There's a lot of muscle attachments, the joint there as well, and irregular discs that can sometimes create a lot of inflammation, tenderness, tightness, and of course, pain. So assessing that, we would feel the muscle and see if the muscles that go over the joint are very tender or inflamed. The next thing we would do is assess for proper jaw motion. So how that would work, we would watch the jaw slowly open and close, just like I performed. If there's any, zigzagging motion as it opens and closes, if these muscles are really tight, if there's clicking, if there's popping, and more importantly, if there's locking, inability to open fully, those are all things that we would look into, but more importantly, pain. All of these things would indicate that there is a TMJ issue. Now, about 12% of the population suffers from TMJ and doesn't know that chiropractic can help. It's pretty commonly occurring with people with anxiety or a lot of stress and they clench their jaw, people who've had orthodontic or dental work that kind of messed up that area. All of those things makes people more prone to TMJ. So what can we do about it? First, during that assessment, we'd feel if these muscles are really tight. These muscles are called the pterygoids, and just like pterodactyl, the P is silent, and also like pterodactyl, it will screech. By that, I mean it's not going to feel great because these tiny muscles are in charge of our mouth opening and closing and chewing. However, because they're so delicate, it's so important to make sure they're properly functioning. The next thing we'd look at is if there's any of that zigzagging jaw motion, we would want to make sure that everything's in the right place. So we would use a chiropractic instrument called an activator to adjust upward on one side, downward on the other to ensure that it's a proper open and close method instead of the zigzagging. If you think you may be suffering from TMJ or you just want to chat with a provider about it, feel free to give us a call at 719-630-7032. We offer free consultations and we'd be more than happy to discuss what we can do to help your TMJ. I hope you have a wonderful day, everybody. Bye!